Hello and Happy New Year. Dr. Stephen Forrest here, Clinic Director at Westport Chiropractic. And this month's short video is just a little update and reminder about some things having to do with COVID. Um, Wish we could all put COVID in the rearview mirror, but if you read the papers, you know that cases are rising and there's a new variant and it's winter time, so we're back sharing small airspaces with other people, which is the biggest danger, is being in enclosed airspaces with large groups of other people. That's why we run high capacity air purifiers here all the time, because that significantly reduces that risk. But what I want to talk to you about is a couple of very simple, inexpensive, natural things you can do that have been shown to significantly lower your risk of COVID. You know what this is? This is called a neti pot, and it's a cheap little piece of plastic that, if you buy it, it probably costs you $5. It probably cost the manufacturer more money to make the box it's in than it did to make the little neti pot. But what you do with it is you put a half a teaspoon or so of salt in it and some warm water. And I know some people think this is a little gross, but you put the tip in one nostril, you tip your head over, and you pour the water through so it goes in your upper nostril, through your nasal pharynx, and back out the other nostril. So you do half of it that way, and then you turn around and you do the other half that way. So the fancy term for it would be saline, because it's a salt solution, nasal irrigation, or just washing out your nasal passages with a saltwater solution. And fascinatingly, the research has shown that it lowers your risk of getting COVID in the first place, not just a little bit, really substantially. If you do get COVID, it clears virus out of your nasal passages way more quickly, so you'll wind up testing negative more quickly and stop being infectious more quickly. Um, so cheap, easy, great thing to do all the time anyway. And it's funny, going back 10 years or so, um, if I asked patients if they were using a neti pot or if they knew what one was, most would say no. I have that. I would explain it to them, and usually we talk about this for sinuses or other gunky head type of conditions that it's also great for. Um, but in the last few years, an awful lot of patients, when I would bring up a neti pot, they go, "Oh yeah, my ENT has already got me using one of those," because this has rapidly moved from sort of a fringe, those crazy natural healthcare people recommended, to something that's become very mainstream because the research supports it. Um, the other thing is, and there's a little more complex story here, but not all that much, is vitamin D. And if you've been listening to our video blogs for a few years, you're probably thinking, oh, here he goes about vitamin D again. But the, the fact is that vitamin D, if research that compares people with high blood levels of vitamin D versus low blood levels of vitamin D, the people with high blood levels of vitamin D have a lower risk of colds, flu, and all upper respiratory tract infections, lower risk of type 2 diabetes, lower risk of all kinds of cancers, lower risk of depression, lower risk of chronic pain. The list just goes on and on and on. But the one I want to emphasize in this context is the lower risk of viral respiratory diseases. And evidence also strongly suggests, can't say it proves, but it strongly suggests that maintaining an optimal vitamin D level significantly lowers your risk of contracting COVID, and of, if you do, makes it more likely you're going to have a much milder case. Um, and as you may know, the natural way to get vitamin D is to lie out in the sun, is to get your skin exposed to the sun. But in the wintertime in New England, even if you laid out naked at noon for an hour, the the sun's rays are angling through the atmosphere at such a low angle that the atmosphere filters out all the UVB rays that would produce that vitamin D. So you can't get vitamin D from the sun in the wintertime in New England. So the best place to get it is from the dirt cheap vitamin D supplements that you can get anywhere. Now, the best way to find out how much vitamin D to take is when you get your annual physical, just ask your doc, if he or she isn't doing it already, to add a vitamin D test to your regular panel of lab work. Um, but you could certainly safely take 1,000 units a day. Um, I personally take a whole lot more than that, but I also know my vitamin D status, so I know that that's safe because it is possible to take too much vitamin D. You got to take an awful lot to do that, but it is possible to do so. So second to getting to having your vitamin D test would be talk to your doc here in the office and get their recommendation about how much vitamin D to take. So anyway, I hope you find that interesting and useful. Once again, Happy New Year, and we'll see you again soon.